7 do's and don'ts after upper eyelid surgery. If you're recovering from upper eyelid surgery, the first 14 days determine the quality of your result, symmetry, scar, visibility, and even how natural your eyelid crease looks long term. Today I'll walk you through 5 essential do's and don'ts based on both clinical research and what I've learned from performing thousands of blepharoplasty procedures. This is the exact postoperative guidance I give to my own patients here in Beverly Hills.
Hi, I'm Dr. Christopher Zumalin, a board-certified oculoplastic surgeon and also the creator of the natural-looking blepharoplasty technique. For me, the goal has always been about restoring confidence through results that look natural and not overdone. Whether it's an advanced eyelid surgery or rejuvenating eyebrow lift through an endoscopic approach or using my Skinula line of products to allow for my patients to have the best sort of recovery possible, I focus on enhancing your unique features while respecting your natural beauty. With a combination of artistry, cutting-edge techniques, and precision, I help my patients look refreshed and youthful without changing who they truly are. And this philosophy has guided me through every patient I've worked with, and it's at the heart of everything that we do here. Because when you look your best, you feel your best. And that's what timeless beauty is all about.
Section 1, understanding the recovery window. Eyelid skin is the thinnest in the body, roughly 0.5 millimeters thick, and has the fastest vascular response to trauma. What that means is you'll see swelling and bruising much earlier than other parts of the body and more dramatically than anywhere else, but also faster healing if managed correctly. For context, swelling peaks at 48 to 72 hours. Bruising usually starts to fade between days 5 and 10. Sutures come out around day 6 or 7. By week 2, most patients are socially presentable, though there's still some microscopic healing that continues for months. I like to say that at 2 weeks, 80% of the bruising and swelling has improved, but there's still that remaining 20% or so that's still there in most patients. Every action you take during this period either accelerates or delays those milestones. Do number 1, elevate and cool strategically. So head elevation isn't just about comfort. It directly affects lymphatic drainage. A 2021 study in plastic and reconstructive surgery showed that patients who maintain head elevation of at least 30 degrees for the first 72 hours had 35% less periorbital or eyelid edema. This is why I recommend my patients to usually sleep on their back using 2 pillows or a wedge. Avoid side sleeping if possible, which can cause asymmetric swelling. When it comes to cooling or ice compresses, we have a whole regimen about ice compresses, and we generally recommend intermittent icing. First day, for instance, of 20 minutes of icing, 20 minutes off. Second day, 20 minutes of icing, 40 minutes off. And we generally do this for about 3 days. That is important because the icing helps improve bruising and swelling within the first few days of surgery. In terms of what to use, always wrap the ice in a soft gauze or cloth, never apply directly to the skin. What we often recommend is just frozen bag of peas that can gently be applied to the face, with a barrier of a gauze in between. That weight and that cold temperature of the frozen bag of peas really helps improve the bruising and swelling pretty efficiently. Direct ice contact actually is not recommended because that can actually trigger vasoconstriction and paradoxically increase swelling once the tissue rewarms. Do number 2, lubricate and protect the ocular surface. Because blinking can be incomplete for several days post-op, dry eye symptoms are common. So these are very temporary symptoms that patients have just because of the swelling, just because of local anesthesia that we've given, and also just from the surgery itself as our nerves need to kind of reinnervate or essentially heal from the surrounding trauma. What I recommend is preservative-free artificial tears every 2 to 3 hours during the day for the first week or so. Ophthalmic ointment or lacquer lube, for instance, or lubricating artificial tear ointment at bedtime really helps in lubrication for those patients that may have a little bit more of dry eye symptoms during the nighttime over the first week or 2. Avoid over-the-counter redness drops, which are often found in some products such as Visine. They contain vasoconstrictors, one particular tetrahydrozoline, that rebound and actually worsen the redness and irritation. So stick to preservative-free artificial tears. Also, limit screen time for the first week or so. I always recommend my patients to limit their use of using their phone, their computer, up to maybe 10 minutes per hour, because that allows for the eyes to not feel strained. And essentially, when you're using your eyes for more screen time, it allows for your eyes to become more dry because you're reducing the blink rate, and it really can worsen your symptoms of dry eyes during the recovery and cause more swelling. Finally, keep incisions clean and moisturized with antibiotic ointment that we provide until the sutures are removed. Then we'll slowly transition you to a medical grade scar product that I've actually invented called Skinula Scar Cream, which is applied twice daily to support collagen remodeling and improve skin quality while hydrating your incision. Do number 3, Fuel healing with nutrition and supplements. Your body's ability to produce collagen in new capillaries depends on micronutrients. Avoid sodium-heavy meals. Avoid processed sugars, alcohol, blood thinners such as ibuprofen and aspirin. Avoid salty foods and spicy foods. What I actually recommend is patients to eat very lean protein, such as turkey or chicken, leafy vegetables, such as lettuce or anything else that's green, such as broccoli, and also colored fruit, which are really rich in antioxidants, including oranges, strawberries, blackberries, blueberries, kiwis, and bananas. Stick with acetaminophen for pain unless instructed otherwise. In addition to a balanced diet, supplements can help optimize recovery. I often recommend Skin to a Bruise, which is an oral supplement that contains arnica, bromelain, zinc, and vitamin C, all shown in studies to help minimize bruising and swelling after surgery. I recommend my patients to start oral Skin to a Bruise about 2 to 3 days before the procedure and to continue it for 1 week post-operatively. Do number 4, protect against UV and support scar remodeling. UV exposure is one of the single biggest causes of post-inflammatory hyperpigmentation in eyelid scars. So once your sutures are out, we still recommend you to stay out of the sun for at least another few days. And once you start to incorporate Skin Nuva scar cream in your healing regimen, we also recommend you to also then apply a sunscreen around those incisions that may be sun-exposed areas. And that's why I developed Skin Nuva Scar SPF, which is a pure mineral zinc oxide SPF 30 that's integrated with our Skin Nuva scar cream. Or you can alternatively use sunscreen of SPF 30 or above on top of Skin Nuva scar cream, and that will just work fine as well in those instances. Sunglasses with full orbital coverage, so not just fashion shades, are definitely recommended, and this is where I highly recommend integrating a medical grade scar product. I personally developed Skin Nuva scar cream, which uses growth factors, selective peptides, in addition to silicone and other clinically proven ingredients to improve scar remodeling at the cellular level. Clinical studies have shown a 2-time improvement in scar appearance when using Skin Nuva scar comparison to silicone cream alone. So you can start applying Skin Nuva scar twice daily once the incision is fully closed, typically after day 10 to day 12, and we'll recommend you on a certain day when we want you to start using that product. So and continue to using that twice a day for at least 3 months for optimal results. Don't number 1, elevate blood pressure or strain. One of the most dangerous though rare complications after eyelid surgery is a retrobulbar hematoma, which can occur if blood pressure spikes or if you strain and force blood into the surgical area. Now, I just want to reassure you, this is incredibly rare, something that we just don't see that often because we optimize our patients before, during, and after surgery. But it's really important for at least 14 days after surgery. Don't lift anything heavier than 10 pounds. Don't bend at the waist. Avoid high-intensity workouts or yoga inversions. Try to avoid screaming, yelling, which, believe it or not, sometimes some patients think it's okay to do, but those actions cause more straining. Even sneezing or coughing while holding your breath can increase venous pressure. So if you ever feel throbbing or deep eye pain or sudden significant pressure and just something doesn't feel right, call your surgeon immediately. It's not something to wait and see, but I'll reassure you, that's not common, but as long as you follow our instructions, you'll be fine. Don't number 2, apply makeup or skincare too early. This is one of the most common mistakes. Eye makeup, fake eyelashes with lash glue, retinoid products should all be avoided for at least 14 days, or at least until the incision line is healed. Oil-based cleaners can break down any new epithelial tissue. Even gentle rubbing while washing your face can disrupt suture lines. So when you do resume, start with fragrance-free, mineral-based concealers and avoid waterproof mascaras for another week. They require tugging to remove. Don't number 3, judge results too soon. I tell every patient, eyelid surgery is a 3-phase transformation: swelling, refinement, and maturation. At 2 weeks, you're still in a swelling phase. The eyelid crease you see at that point is not your final result. Eyelid height, contour, scar color all evolve for the next 6 months. So patience is key. It's normal for the incision at 2 to 3 weeks to still be raised. It's normal for it to be thickened. It's normal to feel a little tender. It's normal for it to be a little red or hyperpigmented. These are normal. So it's important to touch base with your doctor, touch base with me and my staff to make sure how your healing process is, and so we can reassure you. Avoid constant mirror checks or comparing sides. Symmetry takes time to settle. If you follow these research-backed principles, controlled elevation, eye protection, mindful activity, proper nutrition, UV defense, and scar care, you'll recover faster and achieve a more natural, refined, and long-lasting result.